is going to be a really difficult one because whenever I tell clients and friends, neighbors, and family, it's really hard to let go of this myth that fiber is good for us. We need more and more fiber. The myth of cholesterol, the problem with seed oils, and the myth of fiber. Today, I'm going to present to you 4 different doctors: Dr. Chris Palmer, Dr. Paul Mason, Dr. Sean Baker, and Professor Don Layman. The reason I'm showing you these really wise gentlemen is that we've been eating a ton more fiber in America over the last approximately 30 years. And what have we gotten from it? More diabetes, more Crohn's and IBS, more mental health issues, joint issues such as arthritis, skin such as eczema and psoriasis. And it's really due to the myth of fiber, which I'm going to present to you today. Once you start diminishing your consumption of fiber drastically, you're going to notice a difference in your gut health, in your mental health, your skin and joints. So join me today. We'll be on this journey together to talk about the myths of fiber. The trend over the past maybe 20 years is to eat more chia seeds, flax seeds, quinoa, rice, and lentils, and it doesn't seem to be helping us lose weight or do better in the bathroom. So if you give me a few minutes of your time, we'll be on this journey together. I'm glad you're back to my channel, Growth Factor. Fiber is one of the most important topics in your health. What I tell my clients, my friends, my neighbors: when have you ever read a study on fiber? What makes you think fiber is important for your gut? So usually when you go to a doctor and you say, I'm having trouble in the bathroom, constipation, they'll say, take this fiber. I won't name the brand, any pharmacy, and you'll see tons and tons of pills, shakes, powders for fiber. Does it help? No. I've used them in the past. It never helped. And I always wonder, why is it not helping? You know, when you have prunes and prune juice, it usually causes gas. It doesn't help that much. It's not like you are cured. I'm going to show you 2 doctors that explain how to heal from constipation. And who can you guess would be the group of people that are highest in constipation? It's people who eat the most fiber, either fiber from their diet, fiber from supplements. So if you've got kids or grandkids and you're recommending increasing their fiber or getting them pills or powders, I recommend don't do that. There's something you can do, and we could talk about that. There's a book I recommend you buy. It's called The Fiber Menace. And I'll give you a very quick summary. I mean, the basic summary is study fiber. If you look into fiber, you'll see it's not needed. It causes gut problems like IBS and Crohn's. It can cause mental health problems because it's affecting your gut. So you can get anything from anxiety, doom, depression, even schizophrenia. And I can show you Dr. Chris Palmer, who talks about that. He has clients that have schizophrenia. One example is from age 17 to 68. Once she started changing what she ate, getting rid of fiber, her schizophrenia went away. Now I'm going to show you Dr. Chris Palmer. He became a psychiatrist because when he was around 12 or 13, his mother was 42 when she became schizophrenic due to some circumstances within her family. It motivated him to help others, and he does this through utilizing the keto or carnivore diet. And here's Dr. Chris Palmer. His book is Brain Energy.
Her real name is Doris. And Doris had a horrible childhood. She had a lot of PTSD, depression, other things. And by the time she turned 17, she was diagnosed with schizophrenia. She had daily hallucinations and delusions. Over the ensuing decades, she tried numerous antipsychotics, mood stabilizers, antidepressants, and other medicines. None of them worked to stop her symptoms. She slowly but surely gained massive amounts of weight. And, you know, by the time she was 68, she was miserable, hated herself, hated her life. From the ages of 68 to 70, she tried to kill herself at least 6 times and was hospitalized for those suicide attempts. And at the age of 70, she was referred to a weight loss clinic at Duke University, where they were using the ketogenic diet as a weight loss method. And she decided to give it a try for whatever reason. And within 2 weeks, not only did she begin losing weight, but she spontaneously reported that her long-standing auditory hallucinations were going away. Within months, all of her symptoms of schizophrenia were in full and complete remission. Within 6 months, she was off all psychiatric medications and remained in full and complete remission. Doris went on to live for another 15 years. She lost 150 pounds, so the weight loss thing was secured, but much more important, she remained symptom-free from symptoms of schizophrenia. She remained off psychiatric medications. She remained out of psychiatric hospitals. She never tried to kill herself again. And when I last spoke with her, she actually said she was happy to be alive. She attributed her recovery primarily to God, that she really felt that it was a miracle from God. And she asked me to tell her story far and wide to anyone who would listen, in the hopes that it might help even one other human being spare the suffering she endured for decades.
It was our grandparents and great-grandparents that before they fed us fruits and vegetables, they took the peel off. We don't do that anymore. We think we need more and more fiber, but this is how it used to be. Japan still does this, Italy still does this, and France still does this. So if you look up recipes from those countries, they're taking off the skin. Americans, on the other hand, doctors and the American Medical Association and the Dietary Association recommend that you get 30 to 40 grams of fiber a day. And in America, we are one of the most constipated countries. So I don't think you're going to want to follow. As a result of the American way, we now have a pandemic of gut issues like Crohn and IBS, diabetes, cancers, obesity. So are we doing it right? The trend to drink more and more water came because we're eating more and more fiber. The more you drink, the more you urinate, and it's pretty addicting. So then you need to drink more to urinate more, which actually pulls potassium out of your body. Potassium is one of the main causes of constipation. It can cause hard stool. And when you have that situation, your doctor will tell you, increase fiber and increase water. It doesn't seem to work. The fiber most of us eat are in cereals, breads, fruits and vegetables, legumes. Fiber-rich foods contain 10 to 20 times more carbohydrate than they do fiber. And then your colon becomes dependent on fiber to move your bowels when there's something else you can do. Here is Dr. Paul Mason to tell us about the myth of fiber.
I'd like to present to you the best trial that I could find. This was a case-controlled study. So in this study, 63 patients who presented with constipation were recruited, and high and low fibre diets were compared in these patients. And this also included a zero fibre diet that required the complete cessation of all vegetables, cereals, fruits, wholemeal breads, and rice. So this graph here represents the percentage of study participants before the study suffering from each of the symptoms listed on the right side. So you can see, before the study started, all of them had constipation and strain opening their bowels, and a number also experienced bloating, bleeding, and pain. And when the study participants, those who went on a high fibre diet, we can see that the proportion suffering symptoms actually increased, especially bloating. So then there was a reduced fibre arm. And what you can see here is that those on the reduced fibre diet actually demonstrated a modest reduction in symptoms. So the question is, what happened to those, the majority of those in the study, who had zero fibre in their diet? This is not a mistake. I didn't just forget to put something in the slide there. Now, not one patient on the zero fibre diet had any symptoms. That's quite astonishing, really. And these findings were highly statistically significant, highly. They weren't due to random chance. Now, just out of interest, every single person in the low zero fibre group ended up having one bowel action per day, every day. How did this compare to those in the high fibre group? One bowel action on average every 6.83 days. Still think that fibre is good for constipation?
I'm going to show you Dr. Sean Baker, and at the end, I'm going to explain a little bit what I tell my clients, friends, and neighbors, what I recommend. Here is Dr. Sean Baker to tell us about the myth of fiber.
Now, we hear that fiber is essential, that people that eat more fiber are almost always invariably going to have a better health result. And I have some serious questions, and I think there's some nuance around it. So let's get into it. So first claim out there is fiber is what you need if you have constipation. Well, that in fact often is not the case. In fact, fiber is often adding indigestible bulk to your stool. And if you have constipation, fiber has been shown, certain types of fiber have been shown to actually slow down digestive transit time. So that can actually even slow things down even more, which can lead into things like gastrointestinal disorders, constipation, gastritis, dyspepsia, peptic ulcers, IBS, ulcerative colitis, enteritis, or Crohn's from the chronic inflammation that's being seen there. To decrease your chance of constipation-related disorders, research shows that often by eliminating or reducing fiber, that can help significantly. The second claim is that fiber is essential for lowering your cholesterol. Well, there is some level of truth that it can indeed bring down levels of LDL cholesterol. Is that actually good or not? I think that is something that is very much debatable. I think it depends on what your overall situation is. Like I said before, I think LDL cholesterol is a dependent rather than an independent predictor of cardiovascular disease. And I think we're seeing more and more research that supports that. And so the effect that fiber has on that anyways is quite small regardless. And so I would not rely on that to lower my cholesterol significantly to a point where it's going to make a big difference in cardiovascular disease. Eating enough healthy, high bioavailable food is something that's going to provide probably a much better effect. Remember, fiber is indigestible. It's hard to get much nutrition out of there. It basically is just bulk that we just kind of shove through our digestive tract. All right, eating lots of fiber with carbohydrate-filled meals can prevent elevations in blood sugar. Again, this is some nuance here. While yes, it tends to do that, if you compare, say, drinking straight apple juice, which I don't recommend, it's pretty much horrible for you, compared to eating an apple, you are going to have a less of a acute blood sugar spike, but the area under the curve is going to be very similar. You're going to get a slower, more protracted blood sugar rate. So the glucose and the carbohydrate still gets in the system. You still have to deal with it. Is it going to make a big difference or not? Again, that's questionable. This is probably the big fiber protects you from colon cancer. Now, the evidence for this, there is some evidence out there, but it is overall extremely weak. In fact, this 2007 review paper of the literature looking at fiber's role in preventing cancer found that, quote unquote, a strong case cannot be made for a protective effect of dietary fiber against colorectal polyps or cancer. Neither has fiber been found to be useful in chronic constipation and irritable bowel syndrome. So it's I think his claims are largely overrated. So for better or for worse, fiber doesn't seem to prevent constipation, cancer, or IBS. What about weight loss? So people often talk about satiety and weight loss, and some of these claims come around the fact that a healthy microbiome requires fiber, and that's going to help you to have better digestive health, and you're going to lose weight. However, research on both fermentable and non-fermentable fibers show that neither fiber gave much of a significant satiety or weight loss benefit. However, eating bioavailable fats, proteins, and nutrients in meat and other low-carb foods often will trigger your natural safety cues. All right, so my overall take with this is, I think when we look at studies touting the benefits of fiber, we have to look at what is it compared to, right? Typically, it is a standard American or some kind of westernized diet, and that's just a garbage diet. So fiber is often a marker of a better nutrient quality. What is the fiber replacing? Well, if you're taking fiber-rich foods and replacing things like ultra-processed garbage, then it's going to have an effect. It's going to have a beneficial effect, just about anything in that situation. Well, I think a lot of times, so we're not asking what the comparator group is. Are we comparing it to someone on a low-carb, meat-rich diet? Clearly not. Those comparisons have not been made. I see in my own day-to-day observations and practice every single day, people that eliminate fiber from their diet often see significant benefits in our health. So we can't ignore those observations. Now,
eventually you have dysbacteriosis and general dysbiosis. That means you're consuming too much fiber and too little fat. Remember the trend of the 80s and 90s? We were told don't eat fat. And that was one of the worst things we could do. If you look at photos, group photos at concerts or anywhere in the 50s, 60s, and 70s, people were generally thin. And today we're generally chubby. We all struggle with a little bit of belly fat, arm fat, face fat. It's really tough not to be chubby these days. And it is because of an increase in foods with fiber. What happens is when we're consuming fiber through fruits, vegetables, legumes, breads, cereals, we are changing the gut microbiome. So when you switch over to the way of eating that I'm going to recommend at the end, you're going to notice a difference, and it might be uncomfortable for a week or two, but eventually you'll get used to changing your gut microbiome, where you drastically reduce how much fiber you're consuming. Your constipation and issues in the bathroom will disappear. And you can see this through studies. After the proper gut bacteria is gone, fiber replaces it. For a while, this change in the gut microbiome, increasing fiber, it's going to work. It'll make you really proud in the bathroom. You'll say, I go consistently every morning. I go 1, 2, 3 times a day, and it's bulky, but that's not the right way for your body to function. You're not supposed to have these huge things happening in the bathroom. It's your body. What you're supposed to do is eat food. It's supposed to be bioavailable. And so when you go to the bathroom, there's not much there, and there's definitely no wiping. So I'll show you now biochemical nutritionist Professor Don Layman.
How humans evolved to be able to have, bigger brains and cover more distance and all of that. But your point about both digestion absorption and bioavailability are exactly on target. All of the vitamins and minerals that we get from consuming animal foods are all in very highly digestible forms and very bioavailable. If we take protein, for example, proteins that are contained in plants at best are about 65% absorbed. So while the plant may have X amount of essential amino acids, you're only absorbing 65% of it because you simply can't digest it. It's bound up to the fiber matrix. And that's true whether you're talking about B6 or whether you're talking about vitamin A or vitamin D or zinc, whatever. They're bound to fibers. The plant doesn't have nutrients in it for our benefit. The plant has nutrients in it for the plant's benefit. So that means it's integrated into the structure of the plant. And the issue is we can't break that down. One of the beauties of a ruminant animal like a cow or a beef animal or a sheep or a goat is they have a ruminant stomach that can actually break those fibers down and get the nutrients from it. Cattle are what we call an upcycler of nutrients. So they can take an extremely poor diet of grass and silage and even waste products from cotton milling, and they can basically make high quality protein or milk out of it. So they're great upcyclers of poor quality diets to make human high quality diets.
Biochemical nutritionist Professor Don Layman. He not only taught the world that eggs are healthy. Remember, eggs were not healthy. Then don't eat the yellow, only eat the white. And eggs are healthy. And cholesterol is a myth. Based on studies, people who live the longest have high cholesterol. And think about it. If you look up what is cholesterol for, it is for your health. It helps with the sex hormones, estrogen and testosterone. It helps convert vitamin K1 to K2. Your brain is made up of a lot of cholesterol. So we need cholesterol. We don't need to fight it. What has been causing obesity, heart disease, diabetes, Crohn's, IBS? Most likely it is seed oils, which I'll show you, because it's manufactured with hexane, the canola oil, soy, safflower, grapeseed oil, all the oils that are at restaurants because they're very inexpensive. They're made in bulk. It's basically the pharmaceutical industry, the seed oil industry, the fiber industry, cereal industry. A lot of them are the same company. So if you look up all of those products I just mentioned, when you go to the market and the pharmacy, they're made from just a few companies. So really the whole myth of fiber is to get you to eat these products, these bars, these pills, these powders. Is to get you to eat things in boxes and bags like cereal. So if you just really stick to a more ruminant meat eating diet, you're going to have a clearer mind, a clearer gut, clearer skin, teeth, eyesight, hearing, and you'll do it better in the bathroom. So because you're utilizing the food. What happens is when you eat foods with high fiber, you're manufacturing fiber, and those fibers, those parts of the plant, the leaves, stems, and other parts are pulling the nutrients out of your body. So for example, let's say I just had a cup of broccoli and you had a burger, rib, or steak. You are getting close to 100% of those vital nutrients, which is heme iron, DHA, EPA, taurine, vitamin D3, vitamin B12, vitamin A, which is retinol, creatine, carnitine, and carnosine. All these things contribute to proper gut health, which affects your mind. So proper mental health, proper skin, you're going to see your eczema and psoriasis heal. And finally, large stools are what cause your hemorrhoids. So if you feel you're a very healthy eater and you don't understand why you're getting hemorrhoids, it's because you become a fiber manufacturer. You're supporting the cereal industry, the fiber industry, even if you're just getting it from lentils, rice, fruits, and vegetables. You're supporting the fiber myth, and you're going to be affected in the bathroom. So hemorrhoids could be a result. There could be bleeding or just general discomfort. What we become is overweight on a high fiber, which is a high carb diet. And your colonoscopy could show diverticulosis or diverticulitis, which is caused by a high fiber, high carb diet. The impact of dysbacteriosis is Crohn's, IBS, IBD. The way we were taught to eat is not based on studies or science, because when you actually look at the studies in science, you'll stop eating fiber. Your gut will heal, your mind will heal, and your skin will heal. There's usually teenage or adult acne involved in the problem with fiber and carbs that will melt away once you start changing what you're eating. Now that you've been presented the studies by Dr. Paul Mason and Dr. Sean Baker, what I'd like to explain to you is my own personal story. I was struggling in this way. I was eating fiber, the normal SAD diet, standard American diet, and I was struggling. And once I started to increase meats, which a lot of people don't like to hear, but this is what I tell them: your gut, skin, mind, and joints, and your mental health will be affected if you don't sacrifice those animals. So you can sacrifice your mental health, your gut, and other mental and physical challenges, or those animals are sacrificed for their protein, because those animals have all 20 amino acids for you and your mental health and your gut health, as well as all the nutrients we talked about in the beginning of this video, taurine and heme iron. I hope you share this video to help people understand the myth of fiber, and hit the subscribe button, and also find me on Rumble by entering the words growth factor. Thanks for being here today. This is Amalia, here to help you using nutrition and hypnotherapy.